Hello there and welcome to the AM News with me, Kemini Nyamani Amano. Let's take a look at our top stories this morning. Government procures $156 million from the World Bank as loan. What for? Partly to provide free sanitary pads for school girls. Also ahead, hospitals and pharmacies owed monies by the National Health Insurance Authority carries through threats to turn away NHIS subscribers if government failed to settle its indebtedness to them. And then again, we'll see civil society groups and some political parties accuse government of hijacking the constitutional review process. Let me take you through the detail now. The minority government has procured a World Bank loan, part of which would be used to provide free sanitary pads for schoolgirls. Parliament yesterday approved a $156 million World Bank facility to support construction of senior high schools in the country, and out of the money, an amount of $15 million will go into scholarships for over 10,000 students to pursue senior high education. Part of that amount would also be used to buy sanitary pads and distribute for free to schoolgirls. The policy is in fulfillment of an NDC campaign promise, and the Minister of Education, Jane Nana Opoku-Agyeman, stated the issue must be treated with the urgency it deserves. She added that the decision to supply sanitary pads to some less privileged students and their scholarship scheme in the Ghana Secondary School Improvement Program is aimed at encouraging them to stay in school. Let's move up north. The ban on the riding of motorbikes is being blamed for falling educational standards in the Upper East Region town of Boko. According to the Educational Directorate, most teachers as a result are unable to go to their schools, which are mainly out of town, and the authorities point to the pass rate at the Basic Education Certificate examination, which they say has dropped from 79% in 2007 to 34% in 2013. Justice Bedu has been to the town and now reports.
Motorbikes are the main mode of transport, especially in Ghana's savannah zone. But it also means that for towns such as Boko, it's also used by persons with criminal intent, especially hit-and-run attacks in a town that has seen decades of tribal unrest. Following renewed clashes in 2010, authorities there imposed a ban on the riding of motorbicycles. That ban has remained in place for 3 years now, with implications for education, among others.
That would have been very serious. But the emphasis I'm putting is that I'm not supporting the issue that the ban should not be lifted. I'm not saying it shouldn't be lifted. But I'm making a comparative analysis and think that if the security experts say today it should be lifted, fine. But if they think if we lift it, we'll go back to the dark days, then it's better we stay now.
The ban has since been eased for women. Though the restriction on the riding of motorbikes has been hailed as the reason why Boko is now enjoying relative peace, the impact on economic activity in the area is enormous. Musa Tahiru is one of the many teachers here who are paying the high price for the ban. He was posted to the Boko DC primary school last year.
It doesn't mean that what your opinion is always finance. You have to listen to your colleagues. My place to this place, when I get, I will leave house around 6:30. By the time I get here, around 8. When I come, I become tired. I can't teach. I have to sleep for about 2 or 3 hours before I'll get energy to continue. So gradually, this is affecting my performance here. I'm not even happy because I'm supposed to teach. I was born as a teacher. I was not made as a teacher. But when I come and I realize that things are not going well, within myself, I'm not comfortable.
From Boko, he will have to ride a distance of 12 kilometers to and from the school. On a motorbike, he could do the trip in 15 minutes, but on a human-powered bicycle, that will take an hour.
We have people riding the motorbikes, especially men outskirts. When you are caught, 1, they will seize your motorbike. 2, you'll be beaten severely and you sent to the police station. Sometimes they will send you to court. And it will be worse if you are educated. When the militant happens to know that you are educated and you flout the law and you are caught, yours is even worse. So some of us, we don't try at all.
Meanwhile, the people in this town are worried the decline in economic fortunes resulting from the ban may eventually erode the progress made in the peace process. Justice Bedu, Joy News, Oko.
Let's talk about healthcare now. Health Minister Sharia, in consultation with stakeholders, has approved a revised NHIS medicines list. The annual review is to ensure the prices of medicines on the list reflect market trends. The effective date for implementation is July 1, 2014. The three medicines not on the previous list of 522 are artesunate injection 30 milligram, which has been introduced to cater for pediatric doses and prevent wastage after reconstitution. Cholera replacement fluid 1 liter has also been added because it is cost effective and more readily available than the 500 milliliter bottle. The other is ciprofloxacin and tinidazole tablets, which has also been added because the combined formulation is easier to administer than taking them separately. The review reflects an average of 37% upward adjustment of medicine prices in line with the current price changes. But in a related development, Health Insurance Service Providers Association of Ghana has also joined the action of CHAG over the indebtedness of the NHIA. Its Director of Operations and Communication, Atani Delali, insists they will continue to withhold services to NHIS subscribers until their claims of up to 7 months are paid.
As I speak to you, CHAG have started. CHAG institutions are monitoring events. They are not accepting NHIA cards at the various facilities. For the private sector, we started from Upper East. It's ongoing. They are also not accepting the NHIA cards. Patients with NHIA cards to these institutions or region must pay cash.
Anthony Ameka asserted government is taking private healthcare providers for granted.
In some of the regions, for instance, part of Upper East, Northern and Ashanti region, they've not been paid between 7 to 8 months. Some of the facilities too, they've not been paid the January, February and March 2014.
NHIS authorities have blamed the delay in settling service providers on fraudulent claims. Anthony Ameka has, however, challenged the claim.
What we are saying is that, one, they should immediately release our January, February, March unpaid claims to all the facilities. Then we'll go back to the who accept the National Health Insurance cards at the various facilities. Two, we want the Minister of Health to immediately establish the adjudication committee as required by the National Health Insurance Act 852, Section 106. A platform where both parties, the Health Insurance Authority, the service providers and the client can petition the committee for speedily resolution of disputes.
The National Health Insurance Authority is yet to react.
An emergency crisis meeting of ministers of health of 11 countries and partners of the World Health Organization has been opened in Accra to discuss the best ways to halt the further spread of the Ebola virus, especially in West Africa, where it has already claimed hundreds of lives. The meeting will also look at how to tackle the crisis collectively, as well as develop a comprehensive inter-country operational response plan.
More than 400 people have died in what has now become the worst Ebola outbreak in history. Though most of the deaths have been in Guinea, there has been an increasing number of cases in Liberia and Sierra Leone. Health ministers from the 3 affected countries and officials from neighboring Cote d'Ivoire, Mali, Guinea-Bissau and Senegal, as well as Uganda, DR Congo, Gambia and Ghana, are taking part in the meeting, with a number of them said to be at risk from Ebola. According to the World Health Organization, the sharp increase in the death toll in the last few weeks makes intervention critical.
Following our assessment of the ongoing epidemic, we realize the need to put more emphasis on active disease surveillance, laboratory capacity, infection control, social mobilization and communication, and management of logistics and finance. I'm confident that the outcome of this meeting will lead to the adoption of a strategy for accelerated response to contain the Ebola outbreak in West Africa. This is a matter of concern to all of us, governments, partners, and communities, and we should act together to overcome it.
Chief Medical Officer of Liberia, Dr. Benesdam, says one of the key reasons for the continuing spread is the fear and denial around the illness.
Well, for us in Liberia, currently there is a national task force. There are technical committees formed. We have people who are doing contact tracing, case finding, surveillance. We've established a laboratory to diagnose the disease quickly. We've established case management centers. Most importantly, we are doing social mobilization seriously, especially at the interpersonal level. We are also training health workers and psychosocial support. If we can actually work together to address the issues, especially within countries and across the borders, those porous borders, we will make headways.
Ghana's outgoing Minister of Health, Sheriaiti, was hopeful the meeting will yield the desired result.
We are doing a lot of public health education, trying to educate them to avoid eating or coming into contact with certain things, like bats, monkeys, and also to keep, hygienic, sanitary conditions around themselves in the environment. We want to share scientific knowledge, to use the best scientific practices to help our 3 sister countries, so that we can help them, overcome the outbreak, for the rest of the sub-region to be safe, and also to see how we can raise resources to support them.
Matilda Vomagan for Joy News, Accra.
In business, the Ghana Revenue Authority says the suspension of the VAT on financial services is to give them more time to educate stakeholders on it, while affording the authority room for thorough evaluation of the policy. Although the policy is indefinitely suspended, the GRA insists it will be implemented however long it takes.
The Acting Deputy Commissioner for Communication and Public Affairs of the GRA, Kwesi Opon-Damwo, explained that even though the policy was researched into before its announcement, there was a need to address the teething problems accompanying its implementation.
From my evaluation, not all the banks are ready enough to implement. They need to configure their systems, and some of them are not ready. Again, there has been a lot of public outcry, but and I should say a lot of misconceptions. People explain in the way that they understand, and some of the explanations given are not what the law seeks to do. So, even though we've done some explanation and public education, we believe that we still need some time to bring the public on board and do more sensitization. So after our assessment and evaluation of the whole thing, we thought it is necessary to defer the implementation of the VAT on financial services for now.
Having suspended the VAT on financial services twice already, withdrawing the policy again presents the GRA as inconsistent. But the authority says avoiding timelines this time will resolve all credibility matters.
Previously, when we deferred, we gave definite dates. We thought we would be able to do all that is necessary before that date. But we've now seen that, yes, we need to do more. So we decided that, okay, let's put it on hold, do whatever that we need to do, and then when we think by our evaluation and assessment that we are ready, then we bring it back and then implement the law. Because we do not want to set a date again, and maybe at that time too, we'll have to say another thing. The VAT on financial services still remain on our statutes, and we'll do all that is necessary to get it implemented. But then we are not going to take the tax from ourselves. The public need to understand.
Kwesi Damwa maintained the policy was still undergoing some review to address the numerous concerns of the public. Abigail Adomakwenchi for Joy News.
Civil society groups and some political parties are accusing government of hijacking the constitutional review process. According to them, the process lacked transparency and government seems to be pushing through its agenda rather than contributions that were received from the public. They were speaking at a public forum organized by the Institute of Democratic Governance here in Accra.
In March 2014, the Implementation Committee of the Constitutional Review process submitted a draft bill for amendment to 34 entrenched positions of the Constitution and inserted 7 new entrenched positions covering 10 different chapters of the 1992 Constitution. The civil society groups and parties present at the forum, however, believe the process was largely non-inclusive.
This process carefully. The whole process will be an exercise in futility, because the way things are going, in the first place, the CRIC has not been consultative enough in its deliberations. It hasn't published the bill. It hasn't discussed with the public the recommendations that the white paper made, which deviates from the recommendations of the CRC.
Is it a done deal? Because there's some discrepancies between the report of Craig, the white paper, and the bill, which I haven't seen. So is there any forum between now and when it's a done deal where we can still deliberate on the content, especially the gender content?
We want to ask the majority. Is this the people's bill as articulated by the Review Commission, or it is the executive bill as articulated by the white paper? Because there are significant differences in that content. So those are the issues. I'm happy you're talking about building a consensus. Because really, if we all don't know what bill we are talking about, then that is the problem.
Executive Director of IDEG expressed worry over the likely challenges the country may go through if the process is forced through.
The CRIC's proposal is that this be done by December this year. And that means that the 97, or probably they're going to start first. We're not sure about all this. They're going to start with the 41. The time frame, and this time frame, July to December. There are a number of issues there which we think is important to consider, and they raise questions about the feasibility. The first one is that, you know, Parliament has a break for about 3 months. Maybe they will be patriotic to stay to amend the Constitution. That's one. 2, it's not only Parliament. The Supreme Court also has a 3-month vacation between, I think it's July and October. And then when they all return, I think Parliament's first priority usually is to look at the budget and work on the government budget and get it passed in December before they rise for their holidays. And I think they have their own calendar. So it raises a question of what space is there to handle the Constitution amendment issues.
Ghanaians are expected to vote on the proposed changes to the 1992 Constitution, the first time ever a constitution will be amended via a referendum.
You're watching the AM News here. Headlines. Government procures $156 million World Bank loan, partly to provide free sanitary pads for schoolgirls. Also, hospitals and pharmacies owed monies by the National Health Insurance Authority carry through threats to turn away NHIS subscribers if government fails to settle its indebtedness to them. Meanwhile, civil society groups and some political parties accuse government of hijacking the constitutional review process. My name is Atani Delali Emmanuel. Enjoy the rest of the program. Good morning.